If you're watching this, you probably have 100 questions running through your head right now, and maybe you're scared to ask them out loud. That's okay. I'm a doctor, and I'm not here to judge you or push you in any direction. I'm here to answer the questions women ask me most, honestly, calmly, and without any shame attached. Let's talk. Let's start with the simple stuff, because I know when your mind is racing, even basic questions can feel confusing. Abortion is a medical procedure that ends a pregnancy. That's it. That's the plain definition, without any of the noise around it. Medically, there are two main ways this is done, and which one applies to you usually depends on how far along the pregnancy is. The first is called a medical abortion. This is what people often call the abortion pill, although it's actually two different medications taken a day or two apart. The first pill stops the pregnancy from continuing. The second one causes your uterus to empty out, similar to a heavy, crampy period. This option is generally available up to about 10 to 11 weeks of pregnancy, though this can vary slightly depending on where you live and your provider's guidelines. The second option is a surgical abortion, sometimes called an in-clinic procedure. This involves a doctor gently removing the pregnancy tissue from the uterus using suction or, in some cases, other instruments depending on how far along you are. This is usually done in a clinic, takes about 5 to 10 minutes, and you're often awake, sometimes with light sedation or local anesthesia to keep you comfortable. So how do you know which one is right for you? Honestly, it's not really something you decide alone off a checklist. It comes down to a few things: how many weeks pregnant you are, your personal health history, and sometimes just your own comfort level. Some women prefer the medical option because they can be at home, in their own space, with people they trust nearby. Others prefer the surgical option because it's quicker and more predictable. You go in, it's done, and you don't have to manage the process yourself over a day or two. There's no wrong answer here. Your doctor will look at your specific situation, an ultrasound to confirm how far along you are, your medical history, any medications you're on, and talk you through which option actually makes sense for your body. This isn't one size fits all, and a good provider will never rush you through this conversation. I also want to say this clearly: you're allowed to ask every question you have, even if it feels silly or repetitive. There is no such thing as a stupid question when it comes to your own body. This is probably the question I get asked the most, in one form or another. Is this dangerous? Am I going to be okay? What if something goes wrong? So let's talk facts, not fear. Abortion, when done properly by a trained provider, is one of the safest medical procedures that exists. I know that might surprise you given how much noise and misinformation is out there, but the actual data is very clear. Complications are rare, and serious complications are even rarer. In fact, medically, abortion carries less risk than carrying a pregnancy to term and giving birth. That's not opinion. That's what decades of research consistently show. Now, safe comes with a condition. It has to be done properly by a qualified provider in a legitimate setting. This is where a lot of fear actually comes from historical stories or from unsafe, unregulated procedures that happened outside of proper medical care. Those situations were dangerous not because of the procedure itself, but because of the lack of proper medical standards. So what does a safe, legitimate provider look like? A few things to watch for. They should ask about your medical history in detail. They should confirm your pregnancy and how many weeks along you are, usually with an ultrasound or exam. They should clearly explain what will happen, step by step, before you consent to anything. And they should give you clear information on what to expect afterward, including warning signs that would mean you need to come back or seek care. If a provider is rushing you, refusing to answer your questions, or not doing basic checks like confirming gestational age, that's a red flag, and you deserve better than that. Common myths. I want to clear up right now because I hear these constantly. No, abortion does not commonly cause infertility. No, it does not automatically cause severe emotional trauma for every woman. We'll talk more about the emotional side in a bit. because it's more nuanced than that. No, it is not more dangerous than childbirth. These are things you may have heard from people with strong opinions, but they don't hold up against the actual medical evidence. What are the real risks? The honest ones. Like any medical procedure, there's a small chance of things like heavy bleeding, infection, or incomplete removal of pregnancy tissue, which might require a follow-up procedure. These happen in a small percentage of cases, and they're manageable when caught early, which is exactly why follow-up care matters and why you shouldn't disappear after the procedure without checking in. I want you to walk away from this section with one core truth. This is a safe, well-understood medical procedure, backed by decades of data, when it's done the right way, by the right people. Let's get into the physical experience because I know this is often what women are most nervous about. Not the idea of it, but the actual feeling of it. If you go the medical route, the pill option, here's honestly what to expect. After the first pill, you might not feel much at all, maybe some mild nausea or fatigue, but many women feel completely normal. It's after the second medication that things start happening. You'll likely experience cramping, similar to strong period cramps, sometimes more intense, and you'll bleed, often heavier than a regular period, with clots. This usually starts within a few hours, and the heaviest part typically lasts a few hours to a day, before tapering into lighter bleeding that can continue for 1 to 2 weeks. Pain management for this usually involves over-the-counter pain relievers, like ibuprofen, a heating pad, and rest. Your provider will usually give you specific guidance and sometimes a stronger prescription pain medication if needed. If you go the surgical route, the experience is different. During the procedure itself, you might feel cramping, pressure, or pinching sensations, especially if you're having it done with just local anesthesia. Many clinics offer options for sedation, which can make the whole experience feel like a blur, or even like you slept through it. Afterward, you'll likely have cramping similar to period pain, and some bleeding or spotting that can last anywhere from a few days to a couple of weeks. Recovery timelines vary from woman to woman, but generally most women feel physically back to normal within a few days to a week. Full hormonal and menstrual cycle recovery can take a few weeks longer. It's common for your next period to be a little different than usual, maybe earlier, later, heavier, or lighter. So how do you know what's normal versus what's a warning sign? Normal is cramping that responds to pain medication, bleeding that gradually decreases over time, and feeling tired but functional. What's not normal and needs a call to your provider? Fever, severe pain that doesn't improve with medication, bleeding so heavy you're soaking through more than 2 pads an hour for several hours in a row, or foul-smelling discharge. These can be signs of infection or incomplete procedure, and they're very treatable when caught early. This is exactly why your provider gives you a number to call, and why you shouldn't hesitate to use it. I always tell my patients, trust your body. If something feels seriously wrong, don't wait it out hoping it'll pass. Reach out. This question comes up in almost every consultation I do, usually asked quietly, like it's the real fear underneath all the other questions. Will I still be able to have children later if I want to? I want to answer this directly and clearly. A properly performed abortion, whether medical or surgical, does not affect your future ability to get pregnant or carry a healthy pregnancy. This has been studied extensively over many decades across large groups of women, and the research consistently shows no link between a single or even multiple safely performed abortions and future infertility. Your uterus is remarkably resilient. Whether it's a medical abortion, where your body essentially manages the process itself, or a surgical one, where a doctor gently clears the uterine lining, the uterus heals and returns to its normal function, ready for future pregnancies if and when you choose that. Now, I do want to be honest about the rare exceptions, because you deserve full information, not just reassurance. In very rare cases, complications like infection or scarring, sometimes called Asherman syndrome, can occur, particularly if the procedure wasn't done properly or if an infection wasn't treated promptly. This is uncommon, And it's another reason why choosing a qualified, experienced provider matters so much, and why attending your follow-up appointment is important. It lets your doctor catch and treat anything early before it becomes a bigger problem. For the vast, vast majority of women, one abortion, done safely, has no bearing on their ability to have children in the future when they're ready. I've had patients come back to me years later, pregnant with a baby they were excited about, after having had an abortion earlier in life. Your body is not broken by this. It's not a wound that changes your future. For most women, it's simply a medical event that passes. Now let's talk about something just as important as the physical side, how you might feel emotionally both before and after. Here's something I want you to hear clearly. There is no single correct emotional response to this. I've had patients feel an overwhelming sense of relief. I've had patients feel sad or grieve something they still feel was the right decision to end. I've had patients feel numb, like they were just going through the motions. I've had patients feel a complicated mix of all of these at once. And I've had patients feel completely fine with no lingering emotional weight at all. Every single one of these responses is normal. There is no emotional script you're supposed to follow. I know there's a lot of cultural messaging that tells women they should feel guilty or that they'll be haunted by this decision forever. I want to gently push back on that because the actual research doesn't support it. Large, long-term studies, including major ones tracking women for years after their procedure, consistently show that the most common emotional response over time is relief, not regret. Most women who choose this do so after careful thought, and most feel confident in their decision, both immediately after and years later. That said, it's also okay if you feel grief or if it takes you time to process. Feeling sadness about a decision doesn't mean the decision was wrong. Sometimes we can feel loss and relief in the very same moment. Humans are complicated like that, and your feelings don't need to be simple or tidy to be valid. If you're someone who tends to feel emotions deeply, or if you have a history of depression, anxiety, or other mental health struggles, it can help to plan a little extra emotional support around this time. That might mean talking to a trusted friend or family member, or it might mean speaking with a counselor who specializes in reproductive health decisions. Many clinics actually offer this kind of support, either before the procedure, after, or both. I always encourage my patients to talk to someone, anyone, rather than carrying this entirely alone in their head. Not because something is wrong with you if you don't, but because processing big emotional experiences out loud with someone who won't judge you tends to help most of us feel more at peace, faster. And if at any point your emotions feel like more than you can manage, if you're feeling persistently hopeless, or if this experience is triggering symptoms that feel bigger than typical sadness or stress, please reach out to a mental health professional. That's not a sign of weakness. That's you taking care of yourself, the same way you would for a physical symptom that wasn't going away. This is a sensitive topic, and if you're personally struggling with your mental health right now, I'd encourage you to reach out to a counselor, doctor, or support line. You don't have to navigate this alone. Let's shift now into the practical day-to-day questions, the ones about logistics, cost, and what actually happens when you show up for your appointment. First, cost. This varies a lot depending on where you are, how far along the pregnancy is, and whether you're having a medical or surgical procedure. Medical abortions tend to be less expensive than surgical ones, and costs generally increase the further along the pregnancy is. Many clinics offer sliding scale fees based on income, and some have financial assistance programs. It's worth calling ahead and directly asking about cost, payment plans, or assistance options. Most clinics are used to this question and won't judge you for asking. Do you need someone with you? For a surgical procedure, especially if you're being sedated, you'll usually need someone to drive you home afterward, since you won't be able to drive yourself safely. For a medical abortion, you can often be alone if you prefer, though many women choose to have a trusted friend, partner, or family member nearby, especially during the more intense hours of cramping and bleeding. There's no requirement that you have to tell anyone or bring anyone. This is your choice, and clinics are respectful of that. What should you bring to your appointment? Usually, a valid ID, any paperwork the clinic has asked for in advance, a list of any medications you're currently taking, and comfortable, loose clothing. If you're having a surgical procedure, you may want to bring a pad, since you'll likely have some bleeding afterward, and maybe a book or something to occupy your mind while you wait. What actually happens at the appointment? Typically, you'll have an initial consultation, where the provider reviews your medical history, confirms your pregnancy with an ultrasound, and answers your questions. Then, depending on the type of procedure, you'll either be given the medications to take there or at home, or you'll be prepped for the in-clinic procedure. Staff will walk you through exactly what to expect at each step, and you'll get detailed aftercare instructions before you leave. And finally, privacy. I know this is a big concern for a lot of women. Medical care is confidential. Your provider cannot share your medical information with anyone, not a parent, not a partner, not an employer. Without your permission, except in very specific legal circumstances that vary by location, such as certain situations involving minors in some regions. If privacy is a major concern for you, it's completely reasonable to ask the clinic directly about their confidentiality policies before your appointment, so you know exactly what to expect. Let's talk about the days and weeks that follow, because taking care of yourself afterward is just as important as the procedure itself. Physically, you'll want to rest, especially in the first day or two. Avoid heavy lifting or strenuous exercise for about a week, or as your provider specifically advises. Most clinics recommend avoiding penetrative sex, tampons, and swimming in pools or baths for about 1 to 2 weeks, mainly to reduce infection risk while your body heals. Light bleeding or spotting is normal during this time, and it should gradually taper off. Follow-up appointments matter even if you're feeling completely fine. This visit lets your doctor confirm the procedure was complete, check that you're healing properly, and address any questions that have come up since. Please don't skip this, even if everything feels okay. It's a simple, quick way to catch anything that might need attention early. We'll also usually talk about contraception at this point, if that's something you're interested in. This is a good moment to think about what birth control method might work best for your life going forward, whether that's a daily pill, a longer-term option like an IUD or implant, or something else. There's no pressure here. This is simply about giving you options and information so you can make whatever choice fits your life and your body. Watch for warning signs in the days following your procedure. Fever, severe or worsening pain, heavy bleeding that isn't slowing down, or unusual discharge are all reasons to contact your provider right away. These signs are uncommon, but they're important to know, simply so you feel confident and prepared, not anxious. Most women recover fully, both physically and emotionally, within a matter of weeks and go on to live completely normal, healthy lives with no lasting physical impact from the procedure. Whatever brought you to this video, whatever questions you came here carrying, I hope you're leaving with a little more clarity and a little less fear. This is your body, your health, and your decision, and you deserve accurate information without judgment attached to it. You are not the first woman to sit with these questions, and you won't be the last. Whatever you decide, take care of yourself, both physically and emotionally, and don't be afraid to lean on the people and the professionals who are there to support you through it.